It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So folks, it's report card time. We want to know how the Lehigh Valley Hospital in Hazleton is doing. We'd like a report. Where are they ranked? What's going on? How do we know we're getting the best care, health care in northeastern Pennsylvania? Well, the guy who is going to tell us all that, a good friend of mine, his name is Dr. Anthony Valente, no stranger to the greater Hazleton area, been around for 25 years, and he is the Vice President of Medical Affairs. Well, Tony, it's nice to have you on the show.
Thanks, Sam.
How's everybody in Italy?
Everybody's doing very well in Italy, yes. Yeah.
So you discovered that you were a relative of the family.
I am a relative of your family. That's absolutely right, your wife, actually.
Boy, you can pick your friends, but you're stuck with your
own. I was shocked when they gave me the lineage when I got over there and I saw Andrea Marquez on the family ladder.
What a small world, isn't it?
It truly is, absolutely.
It's a beautiful place.
Yep.
Enjoy. All right, so report card time. We're talking about quality initiatives at the hospital, and what does it mean? It means the patient. So we look at what has been happening at the hospital. I've been saying for years, as you know, that we have great health care in the area. More and more people are understanding that and seeing that. So let's talk about, first of all, how is quality measured?
All right, Sam. Well, to look at quality, you have to look at where we start, and we start by treating people using evidence-based guidelines or evidence-based processes to treat particular diseases. And then what we do is we look at outcomes. So you're following evidence-based guidelines to treat, and then you're looking at your outcomes to tell you how well you're doing. And you measure those outcomes using various parameters. It could be anything from whether you're giving appropriate medications to mortality, to readmits. It goes on and on. There's numerous ways to actually measure to see how well you're doing quality-wise. But it all starts with making sure you're using evidence-based guidelines to treat people.
All right. So a patient comes into the hospital. Whatever they're in for, okay, this is monitored. When they leave, they get a questionnaire that they have to fill in. Okay, is this report happen after they submit their report that you begin to look at? Was this right? Was that, etc. Or is this being done as the patient's in the hospital?
Most of it's being done as the patient's in the hospital. And quite frankly, Sam, the patient really doesn't know what's even going on.
I know, I was just going to say
These are all things that are kind of behind the scene. The patients, for the most part, don't necessarily know that you've put them on a particular drug for what they have, that there's good evidence out there that they should be on it. Okay. They don't really realize that, but we monitor that. Okay. That's looked at.
So after you get this data, okay, how is the quality measures used then?
Okay. Well, the data is obviously gathered, it's analyzed, and actually at some juncture it's reported to various entities. It could be reported to the American Heart Association, it could be reported to the American Stroke Association, it could be reported to CMS, which is part of Medicare, it could be reported to the Quality Insights Pennsylvania, which is one of the reviewing agencies in Pennsylvania. So it can go to various entities. Our stroke process actually will get reported to the surveying group that comes every 3 years to give us our recognition as a stroke center. So various entities will look at the data that you've gathered, and then it gets obviously published. It's available. It's publicly available data that you can find. So in turn,
how does this, well, I mean, it's a simple answer, but how does this then improve the community? How does it improve the patients that are at LVH?
Well, I think what it does is, Sam, is if you look at a lot of the diseases that we treat and you look at where we rank and how well we've done with our quality measures, I think what it should do is it should give the folks peace of mind that when they come to the hospital and they're getting treated, that they are getting treated at a facility that is giving them the quality that they deserve and is as good or better than what they can get somewhere else.
Well, that's a proven fact, and we'll learn a little bit more about that. So when you get to the different initiatives, Okay. All right. So we have the patient comes in, and there's, you begin to measure what kind of results they get or what's happening, and you could see the process there. Okay. So now we have different programs. Let's start with the MI Alert program. What's the MI Alert program?
The MI Alert program has actually been there since 2005. It was a process that we started. It takes place in our emergency department. And what happens there is that if you are coming into the emergency department and you have chest pain, if they determine that you're having a heart attack, you are fast-tracked through this MI Alert process, and it follows a very strict set of protocols of what's going to happen to you at particular times, and we get you to a definitive treatment in a very short period of time. I guess that's the Reader's Digest version of it.
Let me give you a scenario here, because a lot of people with apps today, the people that are trained, and we've had your paramedics, and we talked about the helicopter, et cetera, which is fascinating in itself. A person is experiencing pain in their chest or some of the symptoms. Okay, so what's the first thing they do?
Typically,
yeah,
they take an aspirin usually, and we encourage them to come right up to the hospital.
Okay. Or call 911.
Call 911. Unfortunately, a lot of people don't do that. They take an aspirin and wait for it to go away.
Well,
which is unfortunate.
That's the thing. So because now the trained technicians, okay, when that medic comes to pick you up, okay, it is my understanding that there is communication from that person going to the hospital or talking to someone at the hospital as they're picking you up and putting you in the...
Correct.
Okay. So so you're prepared when that person comes there.
Absolutely.
As to what's going on.
Absolutely. Sam, we have gotten a patient, or patients, if you will, from the time they walked in the door and they said, I'm having chest pain. We've gotten them from that point. That's what we call the door time, when they walk in and say, I'm having chest pain. We've gotten them from that point down to Cedar Crest at Lehigh Valley and have the catheter in their body and the balloon opening up the blockage in 41 minutes.
Wow.
41 minutes from the time they walk in the door until the lesion was opened up, in 41 minutes. And that includes the air time down there, which is about 12 minutes.
That's fantastic.
That's pretty good.
Yeah. I mean, when they were on the show, it was just phenomenal what they do.
Pretty good. And that's what that's all about. That's what MI Alert is all about.
Okay.
MI Alert is all about.
Okay, so now we go to the primary stroke center, which here again you guys excel in,
Right.
Let's talk about the your primary stroke center certification.
What we just got recertified, as you can see on there. We're recertified for another 3 years. We were actually the first primary stroke center in northeastern Pennsylvania. And what that means is that if you come to our emergency department with signs and symptoms consistent with a stroke, that you are going to get, again, evidence-based medical treatment that will very much improve your odds of not only surviving, but having a better functional recovery with the stroke. And that may be coming in and getting a medication to open up the artery. It may be us preparing you here and then getting you down to Cedar Crest to actually have some type of a procedure to open up the artery, an invasive procedure some folks need to go through. So again, what being a primary stroke center means is that when you come in, you're going to be assured that you are getting up-to-date evidence-based care for your stroke.
Now, once again, when you're looking at advanced doctors and your care, stroke is something that you should get to as soon as possible.
Absolutely, just
That's
like
critical.
the MI. Exactly right. And again, you want folks that as soon as they have any indication, whether it's numbness, tingling, weakness, facial droop, slurred speech, visual changes, anything, 911 or get up to the ED. Don't wait. That's the key.
And here again, you guys excel in your primary stroke. You excel in that. The trauma center. Okay, let's talk about the trauma center.
Well, again, just got recertified in trauma. Just last couple of weeks, a recertification went through. We're a level 4 trauma center, and what
does that mean, level 4?
Level 4 means I think the best way of doing that is to compare it to, say, a level 1, which is what people see on television. We're not a level 1. A level 1 is where you've got all the bells and whistles. You've got your trauma surgeons, everybody's on call in the building 24 hours a day. We're not that. That's a larger medical center. We're not that, and we don't want to be that. Level 4 means that you are going to be brought to our hospital with trauma, and you will be evaluated very quickly, very thoroughly, and then you will either stay at our place if we feel we can, or you will be transferred to the next level of care, whatever you need. The idea here is that we're saving time in getting you seen by a certified trauma center. For example, let's say you're in a car accident and we were not a trauma center. You would have to go to the closest one. Well, the closest one's obviously out of town. So now you're adding time onto that, what we call the golden hour.
Yeah.
By being a certified trauma center, you now can come to our house, get the proper upfront care that you need, that initial care, and then it's determined whether you're okay to stay or you need to go up to the next level of care.
Let me address that staying situation. Some people feel that, you know, as soon as you go up there, you're shipping them down Allentown, okay? Now, what determines the fact that you're going to be shipping them down Allentown, other than them going to, you know, Allentown themselves or whatever? I mean, what has been the average that you, for example, as there are more doctors, et cetera, in your trauma center or your strokes or whatever, where the stay is, you know, here, other than, you know, as soon as I get it, I know they're gonna put me in a helicopter and send me down there.
Right. Well, no, actually that's not the case. Okay. We transfer about 80 people a month down to, not necessarily just to Lehigh Valley, because there's other circumstances of where they may or may not be going, but we transfer about 80 people a month out of our emergency department, which is, you know, a very small number of the people that actually go in the ED. Our ED is seeing about 35,000 visits a year, looking at roughly about a little under 3,000, you know, a month.
Wow.
So 80 of them are being transferred. You see, so it's a relatively small number, and we look at every transfer. Everybody that's transferred out of our hospital gets reviewed, and we see if it was an appropriate transfer or not. And by far and away, the most common reason for people to be transferred is they require a service that we don't perform here.
Okay.
Like you just said, let's say you need a cardiac catheterization.
Yeah.
You have bled into your brain, something of that nature, an intracerebral bleed. We obviously don't have the capacity of treating that here. Those folks are transferred. So actually, a small percentage of the total ED visits are transferred out.
We were talking prior to the show, Tony, when you're looking at different awards that you get and the ranks, et cetera. It's good to know that, you know, you have our hospitals ranked #1, and we'll talk about the different areas. But your different goal performances, your broad. Okay, how does this? You know, the people just come in and just look at paperwork before they get there. You know, they give you the award. I mean, what are the qualifications needed before we say, all right, giving you a gold certificate?
Okay. Actually, they're very strict, and they're various, and really it would take a lot longer than we have here to go into that. But each one of these organizations has their own set of standards and guidelines that need to be met. Typically, you're looking at following a guideline somewhere around 90 to 95% of the time, minimum, to qualify for just that particular guideline. There may be 10 to 20 items that they're looking at that you've got to show your performance on in order to receive some of these designations. As you mentioned, there's gold and gold plus and what have you. So you've got to maintain a particular level of performance over time. You know, this isn't a shot in the dark. You know, these metrics get reported typically quarterly. The metrics are sent into these various organizations, and then they determine whether or not you qualify for particular status.
Are you under the same guidelines in Hazleton as they are in Philadelphia?
Everywhere.
So there's no
Everywhere
different guidelines for Hazleton versus Philadelphia or New York City?
It's all the same.
All the same.
It's all the same.
So it's the same scrutiny that
all
everyone goes. Folks,
Yep.
I'm talking to Dr. Anthony Valente. He is the Vice President of Medical Affairs. It's report card time, folks. I've been telling you for years about our healthcare system here. Second to none, folks, second to none. We're not just saying that, there's so much. Tony could go on and tell you all the things that are going on. We'll try to hit some of the other areas just so you have an understanding of what it's all about. And remember, if you'd like to find out any information, go to their website. That's number one. And the call to action here would be 570-501-4000. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Report card time for the Lehigh Valley Hospital. And we have here today Dr. Anthony Valente, who is the Vice President of Medical Affairs. We're talking about the quality, how they measure their quality, and all the great things they have. Remember, SSPTV.com. You can watch all of our shows. And also at Lehigh Valley Hospital, Hazleton /Facebook page, you can watch this particular show as well, just so you can get an update of what's going on. Sometimes people want to know, how is our hospital rated? Well, Tony, it looks like we're doing a great job. You and all the doctors, nurses. It's a whole team, isn't it?
It's a team effort.
I mean,
it really is.
LPNs. When you walk in, the people are nice. It
really is. You can't do it. It's not one or two people. It's a whole team.
In going along and talking about the different things, awards that you've had, you have the American Heart Association, Stroke Association, Get With the Guidelines Stroke Program. What's that all about?
Well, what those are, I think you're referring to. Well, we'll do the stroke first.
Yeah.
The Get With the Guidelines is a national program that ranks hospitals across the nation. And you can usually find this stuff in U.S. News and World Report, or it's available online. It's publicly available data. And what they do is they rank participating hospitals based on their performance. And as you can see there, we're a top performer. We're a Gold Plus in both, and we also have what's called a Target designation, which is something they came out with about 4 years ago. They originally had, there was Gold Plus, and then 4 years ago they came out with a Gold Plus and then Target.
What's Target?
Target simply means that you're performing at a level consistent at Gold Plus. It's a Gold Plus Plus, if you will. It's some, again, I don't want to get into the specifics on it with all the.
It's good.
It's good.
It's good. It's good for the area.
You're higher than Plus, and you're maintaining that level over a protracted period of time.
And once again, you don't get that way unless you're doing what is right for the patient, et cetera.
And you're maintaining it. That's the other key. Is it's not this. They don't look at you once and you've hit it. You've hit it, and you've got to maintain it.
Well, you have the same thing with American Heart Association.
Correct. For congestive heart failure, same thing. We're a Target hospital for that as well.
8 years in Gold and 4 years in Target. Reason for it, because they only started.
They just came out with it about 4 years ago. Yep.
When you're looking at again your other programs we have here, you have QIP, which is the Quality Insights of Pennsylvania. Folks, I'm learning a lot about this stuff. All these internal things, but here again, it means something to you. What is Quality Insights of Pennsylvania?
Quality Insights is a state organization that surveys hospitals, puts forth programs for hospitals to participate in, as far as pretty much just what it says. They're an organization that is funded by the state and governed by state that looks at the quality performance of hospitals. And they have various initiatives that they come out with that you can participate in. They survey and review your data, and they're just kind of like an oversight body.
Now, Centers for Medicare and Medicaid Services star rating report. Here again,
4-star.
You guys do pretty good.
Yeah, we're doing okay. We're very proud of that.
Did you fail any tests?
No, we didn't fail.
You didn't fail anything, right?
We're very proud of that.
Okay.
That's a lot of data that they in particular look at.
Yeah, particularly
to achieve that.
And of course, value-based purchasing. Talk about that.
Well, value-based purchasing is actually a CMS initiative, and it means basically what it says. Yes, CMS is Medicare, and value-based purchasing looks at how good your outcomes are per cost, and how well your patients do. And remember, value it's cost and quality is what it is.
It just came to me. Sometimes people think that the doctors, or when they're prescribing something, they may take shortcuts, to save the hospital money, Let's get rid of that myth,
Yeah, you should, because actually the opposite typically happens. I got to be honest with you.
Yeah.
Most folks today are still practicing really good quality medicine and not really looking at what a particular test costs. What you ask yourself before you're ordering a test is, will I act on the information the test is going to give me?
Yes.
And if the answer is yes, you get it.
You know, and here again, I think people think that the doctors go test crazy, okay? And I'll tell you what, I think if you're going to be thorough, I mean, I would want, as much as my blood pressure goes through the roof when I'm getting tested, the fact is that you would want to make sure that it's thorough, correct?
Correct. You want thoroughness, but you don't want to go overboard and do needless testing. That's the key. That's the trick here. The trick here, again, is what I mentioned. You got to say, do I need the test? If I get the test results, am I going to do something with those results? And if the answer is yes to both of those questions, then you get it. If the answer to either one of those questions is no, well then it obviously is a test that you can probably do without.
In terms of doing your internal audits and looking at what's happening, you certainly, I mean, I get this. I was telling you about sometimes you'll get a person who has had a bad experience, okay? And, you know, certainly, you know, you can't judge if those nurses that are working the floors, God bless them. I mean, you know, they're stressed here, they're stressed. They try to do their best, okay? But sometimes, you know, they don't come to your room as quickly as you want to because maybe there's a severe case down there. But however, they don't think that, okay? So to put people at ease, okay, as to the service, and like I said, God bless your nurses and LPNs and everyone who assists. It works that they're there to give you the best quality health care as possible.
Correct.
And these things happen. I mean,
correct. And you know, every hospital has issues. Yeah. There's not a hospital that's in business today that does not have some issue at some point in time with somebody who's not happy with something. And that's not to say that we don't strive to get rid of those cases, because we're constantly striving to not have any, but it's almost impossible to not have any. And you've got to be cognizant of the fact that you're dealing with people and families when people are sick. Sickness causes high stress levels.
Yes.
High stress levels make people very anxious.
Yes.
And you've got to allow some leeway for that and respect that when people are sick, they're not feeling well, and you've got to give them the benefit of the doubt. You know, we all are not at the top of our game when we're under stress or we're not feeling good, so they deserve the benefit of the doubt. You know, if they say something a little bit that might be maybe a little snappy or something, you've got to say, you got to let it go. You got to let it go.
And here again, I don't know how they do it. Okay, my wife's a registered nurse, and I mean, she has the patience of, you know, Job. I want to get to this patient safety very quickly, but I do want to stress on, I was up in Mountaintop and experienced this when we did the show Telemedicine. Mm-hmm. That is very, very interesting.
Neat stuff, yes.
Tell them how that benefits and could save lives.
Well, telemedicine is wonderful, especially in a small community hospital like ours, because it can bring services right to the bedside that you can't otherwise provide in a small community hospital. We now have the capability of bringing the stroke neurologists from Lehigh Valley right into the ED, into the hospital room, so that they're right there with the patient in two-way communication. We can bring an infectious disease doctor, again, right into the room, into the ED, into a patient's room. So you're getting the expertise of specialists and subspecialists in areas that we otherwise would not have that capability of doing, and bringing them right there so they can see the patient can see them, they can interact. There's even different ways to hook up items onto these.
They see the
where
test.
They can listen to the patient's heart.
Yes.
They have all the data flows into it. It's really a neat system.
Folks, if you want to see this, how it works, okay, the show I did at Mountaintop, we had one segment on the telemedicine, and it's unbelievable. The doctor's right there from anywhere that you want, and it's the Sam Lesante / Mountaintop show. Tony, I think that's here again. You have that doctor looking exactly what's going on. I mean, a specialist.
Absolutely. And our plan is to really expand on telemedicine in the future. We think that's really something.
It's just amazing. I keep saying about the healthcare in this area. There's so many great things here. But the readmit reduction program. Okay, this is interesting. Talk about that a little bit. You got a minute?
Well, readmissions are something that we try to avoid. What a readmission means is that you were discharged from the hospital and you came back within 30 days. Our goal is to limit the number of readmissions. What can we do to keep people from coming back into the hospital and coming back in very quickly? So we're looking at that very, very closely. We're looking at ways that we can perhaps give them better care as an outpatient. We can give them better care in the hospital. We can provide them with better services at home. We can make sure they're in the right place when they leave the hospital. There's numerous items that we can look at, and we're looking at that right now very, very closely in an attempt to try to cut down on the number of readmits.
Those reports that people get, the fill-in, I think
surveys, you mean?
Yeah, the surveys. In other words, like, you visit Dr. Benyo, how was this, how was that, etc. I think that's critical to get information back.
Absolutely.
I mean, fill them out, okay, and so people know, and you guys evaluate that.
And everybody gets one.
And I ask you about how many times you meet my good friend John Fletcher, who I think is absolutely doing a fabulous job for our community. I know John many, many years. His whole family was involved in healthcare. You meet with him quite, of course, you've been a native of this area.
Yep.
It's amazing how much I've taught you, Tony, over the years. It's just, Tammy, that's just incredible. But you guys meet regularly, go over everything as much as you can.
Constantly.
Well, Tony, we could, this is always fascinating to me because it just verifies that fact that I'm saying that we have the great healthcare in this area. And kudos to everyone who works at the hospitals.
Thank you. Appreciate it.
They really do a great job,
Thank you.
and have a little patience, folks. I know you get up, nervous. Even me, once in a while, you get nervous. But these people are trying their best. They're working as hard as they can, and they're just as human as you and I are. They have, stress levels. 570-501-4000. Remember, you can go to our website, ssptv.com, and all of the medical shows are on there. Particularly the one you'll see how telemedicine works. But if you go to Lehigh Valley Hospital, Hazleton, Facebook page, you'll be able to see what's going on. But there's a lot more happening at the hospital. Tony, once again, thanks for the report.
Thank you.
We'll see you next time.